cleidomastoid muscles and the clavicles. And we'll also remove these slender muscles, the infrahyoid muscles. We'll see them later. This is the thyroid gland. We'll see it later too. For now, we'll remove it. Here's the thyroid cartilage. Here below it is the cricoid cartilage, hidden by the cricothyroid muscle. These two cartilages form the framework of the larynx. The thyroid cartilage is suspended from the hyoid bone, which is here, by the thyrohyoid membrane. Below, the cricoid cartilage is continuous with the upper end of the trachea. Here on each side, this sleeve of connective tissue, the carotid sheath, contains the major blood vessels of the head and neck. We'll remove the carotid sheaths. We'll also remove the musculoskeletal structures behind and below the larynx. Here's the trachea, here's the esophagus, here's the lower part of the pharynx. To see the larynx from behind, we'll remove the posterior wall of the pharynx. Here's the opening of the larynx, the superior laryngeal aperture. It faces almost directly backwards. The opening is formed in front by the epiglottic cartilage, on each side by this fold of soft tissue, the aryepiglottic fold, and behind by two important structures that we'll meet in a minute, the arytenoid cartilages. The space that's lateral to the aryepiglottic fold is the piriform recess. Here in front of the epiglottis is the back of the tongue. The space between the tongue and the epiglottis is the vallecula. We'll look at a specimen that's been divided in the midline. Here's the epiglottis. Here's the aryepiglottic fold. Here's the divided thyroid cartilage and the divided arch and lamina of the cricoid cartilage. The important features of the wall of the larynx are this small side cavity, the vestibule, and these two folds in the mucous membrane, the vestibular fold above and the vocal fold below. Just beneath the mucosa of the vocal fold is an important structure, the vocal ligament, which we'll see shortly. Here's the larynx in the living body, seen from above with an endoscopic camera. Here's the epiglottis. Here's the left aryepiglottic fold. Here are the vestibular folds. Here are the vocal folds. Here between them, we're looking down through the vocal opening into the trachea. To get a preview of the muscles of the larynx, we'll remove the mucous membrane from here down to here. Some of the muscles of the larynx are visible here. Others are hidden by the thyroid cartilage. We'll see these muscles. We'll look at the thyroid cartilage and the cricoid cartilage in the last section. As we saw, the two cartilages articulate here. When the arch of the cricoid moves up and down, the top of the lamina moves backward and forward. The two cartilages are held together at the front by the strong cricothyroid membrane, which is part of a larger structure, as we'll see later. Now we'll add the epiglottic cartilage to the picture. The epiglottic cartilage is shaped like a leaf, with a slender stem that's attached here. We'll add the arytenoid cartilages to the picture. Here they are. The arytenoid cartilages, which are highly mobile, sit on top of the lamina of the cricoid cartilage, just to each side of the midline. The arytenoid cartilages can move laterally and medially, and they can rotate about a vertical axis. When the muscular process moves backward and forward, the vocal process is abductive cartilage has been removed on the right side. Here are the vocal processes of the arytenoid cartilages. We'll add the vocal ligaments to the picture. Here they are. The vocal ligaments run from the thyroid cartilage in the midline to the tips of the vocal processes of the arytenoid cartilages. They're fixed in front and highly mobile behind. Their tension is affected by the tilt of the cricoid cartilage. The gap between the vocal ligaments is affected by rotation of the arytenoid cartilage. The vocal ligament isn't an isolated structure. It's the free upper border of this cone-shaped sheet of membrane, the conus elasticus. The conus elasticus is attached below, all the way along the upper border of the cricoid cartilage. Its upper border, which is free from here to here, forming the vocal ligament, is attached further back to the arytenoid cartilage. The anterior part of the conus elasticus is firmly attached to the thyroid cartilage, forming the cricothyroid ligament, which we saw earlier. We'll add the cricothyroid muscle to the picture. Here it is. The cricothyroid muscle pulls the arch of the cricoid cartilage upwards. In doing so, it pulls the arytenoid cartilages backwards, making the vocal folds longer. The first muscles to add are the two cricoarytenoid muscles. Here's the posterior one. Here's the lateral one. They both converge on the muscular process of the arytenoid cartilage. Posterior cricoarytenoid muscle arises from here on the back of the lamina of the cricoid cartilage. The lateral cricoarytenoid muscle arises from the upper border of the cricoid cartilage. The posterior cricoarytenoid pulls the muscular process backwards. This rotates the arytenoid cartilage, thus widening the vocal opening. The lateral cricoarytenoid pulls the arytenoid cartilage forwards and laterally, producing a maximal widening of the back of the vocal opening. We'll add the thyroarytenoid muscle to the picture first. Here it is. The thyroarytenoid muscle arises from here on the inner aspect of the thyroid cartilage. It inserts here in front of the lateral border of the arytenoid cartilage. Next we'll add the transverse arytenoid muscle. Here it is. The transverse arytenoid muscle, also called the arytenoideus, is a sheet of muscle that bridges the gap between the posterior surfaces of the two arytenoid cartilages. Let's see how these two muscles work. Contraction of the thyroarytenoid muscle rotates the arytenoid cartilage inward and pulls it forward, along with the cricoid cartilage. This action slackens the vocal ligaments and shortens the vocal opening from front to back. Contraction of the transverse arytenoid muscle brings the two arytenoid cartilages closer together, thus closing the posterior part of the vocal opening. The sphincter action of the last two muscles is augmented by a pair of slender muscles that pass upwards toward the epiglottis, the aryepiglottic muscles. These begin behind the transverse arytenoid muscle, cross the midline, and extend upward and forward a little below the aryepiglottic fold.